Sickle cell disease is a genetic defect in hemoglobin, which is the protein in blood which carries oxygen from the lungs to the body.
Just because of a single change in DNA, red blood cells that are normally round and can get through blood vessels very easily become distorted and very stiff and block blood vessels. When that happens, kids can have crises, the most common of which is severe pain. Other things include stroke, getting blood stuck in the spleen, and several other complications. In people who don't have sickle cell disease, the red blood cells are shaped sort of like lifesavers or discs, and they're fluid-filled. They're sort of like a jelly donut, and they can squeeze through very small blood vessels. But when a child has sickle cell disease, when the hemoglobin from the sickle cells gets clumped together, these blood vessels become very stiff and rigid, and they just can't get through small spaces. And when that happens, the organs don't get enough oxygen and they get injured, and tissue injury and inflammation happens. Even when a child is not having pain or having a crisis, this is happening on a small level all the time in children with sickle cell disease. Sickle cell disease is actually pretty rare. There are only about 70,000 people in the United States with sickle cell disease, and most commonly it affects African Americans. About 1 in 400 African Americans has sickle cell disease.
The sickle cell trait is something that I knew I had. My mother told me about it when I was very young. My brother and I both have it. I believe my mother also has it.
Randy, when I was pregnant with her, is when I found out that I had sickle cell.
It's a genetic disorder. It's inherited, and you have to get one gene from both the mom and the dad.
When we got pregnant and we got tested, because they did the genetic testing on me, she said, well, you have the trait. And I was like, oh, I have the trait.
In California, and now really all states in the United States, there are newborn screening programs that pick up the diagnosis actually within days of birth.
So Trey was born in February 9th, and we found out he had sickle cell disease on Valentine's Day.
Brandy just missed the newborn screening period. She missed it by a few months, so she wasn't detected until she actually suffered a stroke.
We were in church, and her left side of her body went out on her arm and her leg, and my grandmother suggested that we come here. We didn't know what the problem was.
When a child is diagnosed with sickle cell disease on newborn screening, Children's Hospital Los Angeles is the primary place where they'll be referred to in Southern California because of our recognized excellence in their care. Many parents have a sense of guilt that they pass on a disease to their child. And even if they don't have a sense of guilt, there's a recognition early on that having a child with a chronic disease such as sickle cell will change their lives forever.
Kids normally get about seven colds a year or 7 fevers a year. And normally you just watch your kid, you keep them at home, and you can just go on. But when a parent has a child with sickle cell disease who has a fever, that's something that we take very seriously, that can be life-threatening. And even if it's midnight, we tell them they have to go to the nearest emergency room. And if they're young, generally they need to be admitted.
You know, it's scary. You just don't know. You just don't know what you're in store for. And then when you find out what you're in store for, it's even more frightening because you just, every child is different. Every person that has the disease handles it a different way, but it's still, you just don't know what it's going to do to your child.
It's very difficult for the families when they first come, coping, understanding, and learning as much as they can about sickle cell. And that's one of my primary roles as a nurse practitioner, is to provide education for the families so that they can detect problems early and get treatment right away and help their child cope in the best way possible.
I kind of felt like, okay, with the help of this hospital and the people and the doctors here, we can get through this.
One day, one of my teenagers came into clinic and he had his finger bandaged, and I said, "Why is your finger bandaged?" He said, "Well, I smashed my finger in a car door." I can tell you, I know exactly the time and location when I smashed my finger in a car door 30 years ago. And I said, "So how does this compare to your sickle cell pain?" And he thought a lot about it, and after a long time he said, "Dr. Hofstra, it hurts almost as bad as a sickle cell crisis, but not quite. The average pain crisis in a child with sickle cell disease lasts 5 to 7 days. So think about smashing your finger in a car door for a week, and you can imagine what happens to our young men and young ladies with sickle cell disease.
Trey is a wonderful little boy who's a preschooler who loves playing in the park and just being with his family. He's very intelligent, and he is a child who was affected by a lot of pain when he was younger.
It's kind of amazing to watch when he's been hospitalized. Anytime you ask him how he's doing, you can look at him and see he's not really doing all that well, but he'll still say, I'm fine, I'm okay, I'm fine.
So a lot of times he says, I'm great.
And,
I'm great.
Yeah, and you can just look at him and go, oh, sweetie, you can't be great. You can barely breathe, or you can't possibly be great. And he's like, I'm good, Mom, I'm good.
Atreyu had some pretty significant complications early in life. He had a lot of fevers, which required him to be hospitalized. He had acute chest syndrome, and he had several pain crises. As a result of that, we started him on a medicine called hydroxyurea. Hydroxyurea is a medicine that reduces sickle crises in most patients.
There's things that you can do to treat it, but there's nothing like seeing your child in pain and being really nothing you can do about it.
It's really hard seeing the kids with sickle cell suffering and having pain. And I can only imagine what the parents feel like when they're at home seeing their own child experience this.
Like if she has her, say even if something as simple as take a shower and wash her hair, just to dry her hair. Because if she go outside and it's cold and it's windy, she can get a crisis in her head. And the crises are pretty severe on them. It hurts them a lot.
There were some times when he was much younger and he was hospitalized where I had a very hard time being in the room if he was getting an IV or if they were taking blood. You know, the look he would have in his eyes and the look he would look at us with, almost begging us to stop them. It was just, it was too much. There were times where I would have to leave the room. I remember one time specifically being in a different waiting area, and I had been crying, and I said to my wife at that time, I don't think I can do this again. I don't think I can have another child with the possibility of this happening to them.
Since Atreyu has been on hydroxyurea, the number of pain crises he's had has dramatically decreased, and he has had far fewer hospitalizations. He's actually kind of an ambassador for sickle cell disease in many ways.
When he was really young, he also had to have a whole body exchange where they had to basically take all the blood out of his body and replace it with new blood. And because he was so young, they had to do it manually. And so it was like, 5, 6, 7 hours?
Several of the more severe complications of sickle cell disease require blood transfusion to manage them, in particular stroke or sickling crises that occur in the lung. If patients have had a stroke or have had a lot of acute sickling in the lung, they require transfusions every 3 weeks for the rest of their life.
Unfortunately, there are problems with blood transfusions. In the African American community, blood is not exactly the same. They have proteins on their red blood cells that are different than just the A, B, and O.
So if they're transfused multiple times, their bodies ultimately recognize that the blood is coming from a different ethnic group, and they develop antibodies are no longer able to tolerate the transfusions.
The second problem is, as they get the transfusions, they also build up iron.
She takes a shot home every night because by her getting the blood transfusion, her iron goes up really high.
You basically have to take the medication over 8 or sometimes 24 hours a day to get rid of the iron, because if you don't get rid of the iron, the kids can die from heart problems, they can develop diabetes, they can have liver disease. So they need to take this medication to get rid of the iron, the byproduct of receiving the blood. We transfuse approximately 100 kids here with sickle cell disease, and we need about 400 units of antigen-matched blood, specifically matched blood for our patients. And unfortunately, frequently we don't have that blood available.
There is a huge need for blood donors, not just in the African American community, but in general, because as more and more restrictions come on blood donors to ensure the safety of the blood supply, more and more regular donors are not eligible to donate. And there's always shortages of blood.
You don't realize how important something like a sickle cell disease clinic is until you realize that there are very few hospitals that have it. Not only are there very few hospitals that have it, but there are even fewer hospitals that are equipped to actually deal with the disease.
We are a comprehensive sickle cell center. That means we have physicians, we have nurses, and we have social workers who work with our patients with sickle cell disease.
Everybody here is so good. They're so good with her. Considering what she goes through, they make them very comfortable. They do.
Dr. Malik is working on gene therapy to cure sickle cell disease. Until then, one of the few options, the only option to cure sickle cell disease is bone marrow transplantation. Unfortunately, less than 1 in 4 children with sickle cell disease has the opportunity for transplant because they have to have a brother or sister who is a bone marrow match but also does not have sickle cell disease.
There's definitely hope with sickle cell. Even though sickle cell can be a devastating, life-threatening illness, people can cope and thrive with sickle cell disease.
Well, the thing that keeps me going and focused in sickle cell disease really are the patients that I deal with. We develop very close relationships with these families because we take care of them over a long period of time. And for me, that's really the attraction, is the kids.
I love seeing the kids after they've been in the hospital and so sick come to clinic and just have a really good time and are happy and healthy and playing in the playroom, and that makes it worthwhile.
As long as she keeps her mind focused and know what's good for her, takes care of herself, I think she'll be fine. And she's educated, you know. The hospital plays a big part in that. They educate me, they educate her, helps her learn to take care of herself.
We are extremely thankful for all the work and for the clinic and for the ability to bring the education and just help all of the children that they've been helping here at the hospital. This has been wonderful for us.